Thank you everybody for your time and in joining this virtual open day to launch our UCL Master's course in Oncology. My name is Tanya Ahmed. I'm a consultant in medical oncology at UCL and UCLH. And I'd like to introduce the rest of our course steering committee, Barry Schooling, who you have just heard from UCL, Dr. Mark Gaze, one of our clinical oncology consultants who has been instrumental in devising this master's course, and Pippa Bark-Williams, Associate Professor at UCL, to help us with the educational aspects of this course. So this is just a very brief taster. I'm hoping all of you will have seen our flyer that gives more detail and also have been signposted to our UCL MSc Oncology course website that gives a lot more information about the curriculum, the learning methods and the assessments. But this was really just to launch our masters and to give a flavour of what we're hoping you will be applying for. So without further ado, I'll make a start. So first of all, where are we and who are we? Well, we are a big oncology department based at both UCL, which you see on the left for anyone that isn't London-based or doesn't know. We're right in the centre of London, just near Euston. We're a large university with worldwide reputation, and our clinical colleagues are based at University College London Hospital, which is shown on the right. We are a big tertiary teaching hospital situated right next door to University College London. The MSc in Oncology course is going to be delivered primarily by faculty based at UCL and UCLH, but also our partner hospitals within the North Central and North East London network as well. So this is just to give context as to where we are. So just to introduce our master's course, well, the course is primarily for any newly qualified doctor starting to train in oncology. By newly qualified, I mean you have just received a training number or ST3 placement for an oncology training program, whether that's medical or clinical oncology. We expect you to have finished membership and starting your oncology training at a certain base hospital or on a certain rotation. And this is open to both medical and clinical oncology training number holders. In the future, our master's course will hopefully attract international students, but for now we are keeping it to UK graduates. So we have had full approval by University College London over the last 18 months as this course has been developed, and we are due to launch our Year 1, Module 1 in September this year. As you can see, the structure and the timing, it is a flexible and hybrid remote learning course where Year 1 studies will contribute towards a PG cert or PG certificate. Year 2 will be PG diploma, and for those that wish to pursue a third year, that will lead to the award of a master's in oncology. And this will be alongside your clinical training as specialist registrars in medical and clinical oncology at your base hospitals within your rotations. So just to be clear, we have developed our course in close alignment with both clinical oncology and medical oncology specialty training curricula, which I've just shown here, to make sure we incorporate all of the necessary aspects of training and your capabilities in practice that you're required to attain both through your clinical training as well as this learning, to make sure that our modules map closely to every single topic that you are that you need to cover. So just to map out what this looks like, in Year 1, for example, those that will be joining us in September, we have our course split into different modules. As you can see, Module 1 is breast and lung, Module 2 is GI and uro-oncology, and this will be a combination of face-to-face learning set in 3 different sections during the course of that year. But most of the teaching will actually be online, and this allows flexibility in learning. We understand that other oncology courses that are available have been primarily on-site, face-to-face teaching and have been restricted to only certain days of the week, which can cause problems when you're in busy clinical jobs on your rotations where you may be missing an essential clinic or an MDT. Our model will give that flexibility where you can undertake the learning in your admin time or with agreement from your clinical teams so that it doesn't impinge on your own time at home, there will still be study leave required, but this can be flexible during your working week, and your face-to-face commitments will be confined to 3 days, as you can see, the induction, a mid-year 3-day course, and then towards the end as well, where we will be completing assessments as well as more face-to-face interactive teaching sessions. So that just gives an idea of how our course is different from currently available courses, where your teams will not need to release you for a whole day on the fixed day every week as existing courses do require. Year 2 will be very similar, with the modules running and a combination of pre-recorded online teaching, real-time but interactive virtual tutorials, and face-to-face sessions. And then the 3rd year will incorporate a research project either through our own UCL Cancer Institute or our colleagues across next door at the Crick Institute, which is a biomedical research centre with world recognition. We have close ties with both those institutes, and hopefully we'll be able to provide adequate opportunities to pursue particular research projects of your interest to complete your 3rd year and your master's dissertation. So just to give an example, module 1, as you can see, we use lung cancer and breast cancer to complete the clinical education for those particular subjects, but at the same time we integrate it with molecular, cellular and radiation biology, as well as epidemiology, statistics and clinical trials. And so we've really favoured this integrated way of teaching, so that rather than just your horizontal modules, we try and cross-link. So for example, in lung cancer, as well as learning the clinical diagnosis, management, treatment and data to support lung cancer treatment, we link it with the molecular and cellular basis of lung cancer and look at how that has also affected our management in clinical practice. And similarly, we'll be bringing in teaching on clinical trials within lung cancer. And as with breast cancer as well, we're trying to integrate all 3 streams to really give a comprehensive overview of both these tumor types. And that will also be taken forward in the 2nd year as well. So just to give an example of module 1, as we start in September, as I said, there'd be a 3-day face-to-face course induction and an introduction to module 1, and we already have the dates of that fixed. And then the rest of the teaching will be a series of pre-recorded short 30 minutes pre-recorded lectures distributed between those subjects, as you can see: breast cancer, lung cancer, epidemiology and statistics, and then cellular, molecular and radiation biology. But then they'll also be followed up with a series of weekly virtual online, but in real-time interactive tutorials with key opinion leaders and lecturers from those specialties, so you can really consolidate your learning and have the opportunity to ask questions, interact with those tutors, and hopefully give a more rounded experience, and any of your queries can be answered. And then there'll be a final wrap-up session later on in the year where further interactive sessions such as clinical trials workshops, real live MDT simulations can take place, as well as the assessments, which we'll have more information about on our website. So just to give a little bit of detail without going into too much of the semantics here, for example, the breast cancer lecture topics are listed in line with the curriculum. But what we're hoping to achieve is, rather than just dry teaching of each of those, we're incorporating the science behind it, the clinical trials and the evidence base behind all of these aspects, so that at the end of the breast module, you've had a more 3-dimensional teaching and learning experience. Similarly, with the lung cancer module, we're bringing in more innovative techniques such as proton beam therapy, SABR, links to artificial intelligence, just to really bring the teaching into the sort of the new era that we're facing in medicine. Statistics, for example, is something that's commonly not really dwelled on too much. We want to go into a great deal of detail, given how important this is for both medical and clinical oncology and clinical trial interpretation and conducting clinical trials. So I think what we offer, perhaps above and beyond current existing courses throughout the country, is we're trying to incorporate a really diverse range of learning opportunities, as opposed to face-to-face lecture-based tutorials for the whole of the 2 or 3 years. We want to, for example, have simulated MDT sessions where you can really feel what it's like to be part of an MDT. As new registrars, this will be part and parcel of your week-to-week work, and really kind of launch that as an experience that you can take away. We're hoping to conduct some clinical trial workshops so that you can understand protocol design and how to conduct clinical research. We have modules that are focusing on the role of artificial intelligence in healthcare and the way that this is being incorporated into all aspects of oncology, from radiology, diagnosis, as well as looking at patient monitoring and patient experience. And finally, we realize the value of social media and the fact that we can't escape this, and we need to incorporate social media tools in our oncology teaching and also interaction with patients. So these are just some examples of how our course is slightly more innovative than more traditional courses, and there'll be more information about this to come, including in our face-to-face open day. So finally, the next steps for you as prospective applicants. As I've mentioned, we have a face-to-face open day. The details are in the flyer and on our website. And it would give you an opportunity, certainly for those of you that may not be familiar with us in London, to come and visit our UCL campus, the Cancer Institute and the Cancer Academy, just to have a look around and meet colleagues from our faculty. If you are interested in partaking in our course, obviously you need to submit the application. The deadline, the dates are all available on our website. And I would advise you, if you already have placements now, once you have secured your training number with your base hospital, and the earlier you contact your consultant and the teams that you'll be working with, the better to make them aware of your plan to undertake our course, what it entails, and just to please reiterate to them, the beauty of this course is that you will not have to be released on the same day every week for 8 or 9 months or so. There is much more flexibility in our course, but you still will be given or need to be given adequate study leave scattered amongst your working hours to be able to undertake the learning with the pre-recorded tutorials as well as the interactive sessions, and of course the face-to-face modules that come throughout the year. It's important to contact your educational supervisor as well as the training program directors to inform them of your interest in this course, so that they can also make the necessary provision for you, including looking at the funding, which we have confirmed from Health Education England will be available for this year of learning. And again, of course, don't forget to submit your study leave applications to your hospitals in plenty of time. So I think I'll leave it there.